Breakfast is where I see people sabotage their kidneys the most, and they have no idea they're doing it. I'm a certified nephrology nurse, and for almost 30 years, I've cared for people whose kidneys fail. My goal here is simple: to make kidney health easier to understand. And one of the most common things people with kidney disease tell me is, nobody ever told me what to eat. So this morning, let's fix that. I'm going to show you the breakfast foods that generally support your kidney health, the ones that can quietly work against you, and how to build a kidney-friendly breakfast without giving up foods that taste good. This is the exact kind of conversation I have with my patients and their families. If this is helpful, give me a quick like so I know to keep making videos like this. Let's eat. So let's start with the basic question. What actually makes a breakfast kidney friendly? There are a few principles that are helpful for most people. The first is sodium. Too much sodium can make your body hold on to fluid and raise your blood pressure, and both can create problems when you're trying to protect your kidneys. So lower sodium choices are generally a good place to start. The second is choosing more whole or minimally processed foods instead of relying heavily on packaged foods. That's not just general health eating advice. Packaged and processed foods can be major sources of hidden sodium and phosphate additives. And I'll show you how to spot those additives in just a minute. And third, think about your blood sugar and your heart. Diabetes and high blood pressure are two of the biggest causes of kidney disease. So a breakfast that supports good blood sugar and blood pressure control is also helping you protect your kidneys. But here's where kidney nutrition gets confusing. Potassium, phosphorus, and protein are not a one-size-fits-all. Some people with kidney disease need to watch these very closely. Others may not need the same restrictions. It depends on things like your kidney function, your lab results, your medications, whether you're on dialysis, and your overall health. And that brings me to one of the questions I hear all the time. Why do different doctors and kidney websites tell me completely different things? I understand why that's frustrating. It's frustrating for me. You hear one thing from one source and the opposite from another. And eventually you're wondering what you're supposed to eat at all. But here's the part that clears up a lot of that confusion. Kidney friendly does not mean exactly the same thing for every kidney patient. Protein is probably the easiest example. If you have chronic kidney disease, CKD, and you're not on dialysis, you may be advised to moderate how much protein you eat. But once someone starts dialysis, protein needs generally increase. So one kidney patient may be hearing, be careful with your protein, while another is being told, you need to eat more protein. That sounds completely contradictory until you realize they're not the same patient. Potassium and phosphorus can work the same way. One person may need to limit certain foods because of their kidney function, treatment, or lab results, while another person may be able to keep those same foods in their diet. That's why I don't want you walking away from this video with another giant list of foods labeled good or bad. Your kidney-friendly breakfast should fit you. And if you're hearing me talk about potassium, phosphorus, EGFR, and lab results and thinking, okay, but what do my numbers actually mean? That's exactly why I created my free Kidney Lab Companion. It walks you through the important kidney numbers in plain English so you can better understand what you're looking at and what questions to ask your healthcare provider. I'll put the free download below. Okay, now that you understand why the rules can be different, let's get to what you came here for. What can you actually eat for breakfast? Let's start with eggs. Eggs can absolutely fit into a kidney-friendly breakfast. They're a good source of protein and are naturally low in sodium and potassium. Whole eggs do contain phosphorus, so depending on your individual needs, you may need to be mindful of how many you're eating. Egg whites can be especially useful when you want protein with less phosphorus. So you don't need to hear kidney disease and automatically throw away every egg yolk in your refrigerator. The better question is, does the amount I'm eating fit my individual kidney nutrition needs? Next, oatmeal and whole grains. Plain oatmeal can be a very practical, high fiber breakfast. And here's something important because this causes a lot of confusion. Phosphorus, naturally present in plant food, isn't handled exactly the same way as phosphorus added to processed foods. So, seeing phosphorus associated with oats doesn't automatically mean oatmeal is off of the menu. The portion matters. What you put in it matters, and your individual nutrition needs matters. Add some berries, for example, and now you've added fruit, fiber, and natural sweetness without needing a bunch of added sugar. Toast can work too. And here's where I want you to learn a habit instead of memorizing a particular brand of bread. Turn it over and read the label. Bread can contain more sodium than people realize, even bread that looks healthy. Compare a couple of brands and choose the lower sodium option that works for you. Now, let's talk about peanut butter, nuts, and seeds, because these can cause so much confusion. People hear nuts contain potassium, nuts contain phosphorus, nuts contain oxalates. Kidney patients shouldn't eat them. Not necessarily. Most people with CKD don't automatically need to eliminate nuts and seeds simply because they contain potassium or phosphorus. How much you eat depends on your kidney disease, treatment, and individual needs. And here's another distinction that's important. Kidney disease and kidney stones are not the same dietary problem. If you're following a specific diet because you form kidney stones, there may be additional considerations such as oxalates. That's a separate conversation from general CKD nutrition. So now that you know some foods that can work, what deserves a little bit more caution? Processed breakfast meats are high on that list. Bacon, sausage, ham, and similar processed meats can pile a lot of sodium into one meal very quickly. Some also contain added phosphorus, and that leads to one of the most useful label reading tricks I can teach you. Look at the ingredient list and scan for the letters PHOS. You may see words like phosphate or phosphoric. Those are clues that phosphorus has been added to the food. Added phosphorus is absorbed much more readily than phosphorus naturally present in many whole foods. So don't just look at the nutrition facts, look at the ingredients too. Highly processed and sugary breakfast deserve some attention as well. Sugary cereals, pastries, and many grab and go breakfast foods can combine added sugar, sodium, and heavily processed ingredients in one meal. I'm not telling you that one bowl of cereal is going to damage your kidneys. The bigger issue is the eating pattern. If breakfast every morning is working against your blood sugar and blood pressure, eventually that matters for kidney health too. And finally, be careful with the idea that more protein is always better. Protein needs change with kidney disease, and they're very different once someone is on dialysis. So don't compare your breakfast to somebody else's high protein meal plan and assume you need to copy it. Now, let's put this together because food lists only get you so far. Here are three simple breakfast ideas. First, oatmeal. Plain oatmeal with berries and a small amount of unsalted peanut or nut butter if those foods fits your individual plan. Simple, filling, and you can adjust the portion or toppings based on your needs. Second, an egg breakfast. Eggs or an egg white scramble with vegetables plus some fruit or toast. And remember what we talked about earlier. Someone on dialysis may need more protein than someone with CKD who isn't on dialysis. So even the same basic breakfast may look different from person to person. Third, toast with nut butter and fruit. Choose a bread that works for you. Compare the sodium on the label. Add some unsalted peanut or nut butter if appropriate, and pair it with berries or another fruit. None of these are meant to be rigid renal meal plans. The real skill I want you to walk away with isn't memorizing a list of approved foods. It's understanding how to build a breakfast that supports your kidneys while still paying attention to your own labs, treatment, and individual needs, not somebody else's. Now you know what a kidney friendly breakfast can look like. But breakfast isn't just what's on your plate. What you're drinking every morning matters too. So, what should you actually be putting in your cup? That's exactly what I break down in the video that's on your screen. The 5 best morning drinks for your kidneys. I'll meet you there.